Hello, I'm Dr. Tara DeLiberto, creator of Integrative Modalities Therapy, or IMT, for eating disorders, and this is IMT Training Video 3. The topic for today is eating disorders do not discriminate. I'll start off this video by telling you a little story. A few years ago, I was invited to give a grand rounds talk at an inner city hospital in Queens, and the person who invited me to present said, "We don't really treat eating disorders here, but it's an interesting topic, so why don't you come and present?" And I thought to myself, I know exactly how I'm going to start this talk. So I started the talk by asking who in the audience treats eating disorders, and nobody raised their hand. And I asked if anyone had ever seen a patient in this hospital with an eating disorder. Nobody raised their hand. And then I said, well, I know for a fact that people with eating disorders are treated in this hospital because I've treated patients from this hospital with eating disorders before. In fact, one of the very first patients that was referred to the program that I started at New York Presbyterian Hospital was from this hospital. And the main point, of course, was that eating disorders do not discriminate. They exist everywhere, and anybody could have them. What's the stereotype of someone with an eating disorder? We all know. White, young, female, from a high socioeconomic class, probably intelligent. These kinds of stereotypes are always applied to people with eating disorders. So the truth of the matter, though, is that eating disorders can start at any age. Anyone at any age could have an eating disorder. Eating disorders impact people of all genders, races, ethnicities, socioeconomic status, you name it. We've seen it. It exists. And it's really important to stress this fact because what happens is that clinicians aren't detecting eating disorders in people of color, of people from different backgrounds, in older people. They're just going completely undetected because people are not screening for eating disorders. In fact, to my knowledge, it is not a government requirement that hospitals and mental health settings even screen for eating disorders. Of course, we have to screen for things like pain, suicidality, but eating disorders are the deadliest mental illness, and they really do deserve to have the same sort of importance placed on them in terms of screening as suicidality and pain. And we're really far behind in 2019 on screening. Even at some of the best hospitals around, people are not screened for eating disorders because it's not a requirement. So what I really suggest is the following. As a clinician, screen all of your patients for eating disorders. All of them, without exception, regardless of how old, young, whatever they may be. So what can you do? A really common screening tool is called the EAT26, all caps EAT26. And it's a freely available measure, and it gives you an idea of the degree of eating disorder symptomatology that might be present. It doesn't provide diagnosis, but it gives you an idea of how much a person might be struggling with an eating disorder and whether they either need to be referred out or be screened for actual eating disorders and treated. So in addition to the E26, you can also ask 3 very simple questions and get a good idea of whether or not a person might have an eating disorder. Number 1, on a scale of 0 to 10, how afraid are you of gaining weight? Now, a lot of people may not want to gain weight, but that's a very different thing than fearing weight gain. Because when someone fears weight gain, they then engage in all sorts of behaviors that can be very dangerous and also impair their level of functioning and also degree of satisfaction. So these sorts of behaviors should also be assessed for. So number 1, ask on a scale of 0 to 10, how afraid of weight gain are you? And then you can ask about any sort of behaviors that someone might engage in that fit an eating disorder profile, such as intentionally purging in order to get rid of calories or to lose weight. Has the person ever used laxatives towards the same end? This type of question. How might you phrase it? You can just ask point blank. Have you ever engaged in purging in order to lose weight? Have you ever used laxatives in order to lose weight? Have you ever engaged in any sort of behavior like this to lose weight? And see what the person says. In addition to those two questions, a third question that you might want to ask, it's a little bit more involved, but worthwhile to ask pretty much everyone, is what a daily diet might look like for a person. What are they eating for breakfast, lunch, dinner? What are they snacking on? When are they eating? And getting an idea of what a day in the life of your patient is in regard to what they're eating. This might give you information such as, are they restricting all day and then binging at night? Are they avoiding specific foods? And just generally, what is their lifestyle like in regard to food? So these three questions are highly recommended from me to ask all patients in addition to screening with an Eat26. And that is pretty much it for today. One last thing that I'll mention is that there are efforts being made by organizations to generally destigmatize eating disorders and also raise awareness about the fact that eating disorders can impact anybody. These organizations are, for instance, World Eating Disorder Action Day, which is on June 2nd, the Academy for Eating Disorders, NEDA, and also IADEP. So these are organizations that are doing a really great job to, again, destigmatize and also break down stereotypes. Thanks so much, and I'll see you. Actually, now one last thing. Because eating disorders do not discriminate, we have chosen not to use any gendered pronouns in any of the IMT literature. We use the pronouns of they, their, and them instead of, again, anything gendered, because eating disorders can impact people of all genders.